Hi everyone, this is Tom, and in this video I want to talk about how to use mind maps effectively. And there's a kind of good way of using mind maps, which I think is incredibly powerful and has been really helpful over the course of my studying career. And there is a less good way of using mind maps, which can actually reduce how effective your studying is. And I've been a victim to this bad way. So I'm going to talk about both ways, and I'm going to explain the kind of theory behind it and a practical way to implement that. And then I'm going to give you a demo of exactly how I would use mind maps to study a topic. And we'll go through a topic together. So let's get straight into it. Firstly, I want to talk about what are the benefits of mind maps. And this may not be your first time coming across mind maps. I'm hoping that you may have come across them before, you may have watched some other videos, you may have read books about them. So I'm not going to go into super detail about exactly what mind maps are, but you'll probably pick it up as we go through this video. So some of the benefits. Firstly, it helps you process information. Secondly, it helps you visualize the content in a kind of visual way, mapped out in front of you rather than big blocks of text. And thirdly, it helps you to learn. So let's dive into more detail about these. So it helps you process if you've got like a complex topic, and that complex topic is in big chunks of text in a really complex, detailed, difficult to read textbook without any visuals, without any illustrations, just big chunks of text. Say you're reading like an academic paper. It's very dense information. And mind maps will help you to process that dense information and understand it. So it improves your kind of understanding because you can link things together, you can simplify, you can bring out concepts and map them out kind of like we're doing here on the page. Helps you visualize the kind of big picture. So rather than just a block of text with lots of little details, the little details get lost and you don't really, although you're picking up on small details of vocabulary or little facts, you're not seeing the bigger picture. But with mind maps, you can map out the whole picture. And then you see how the components fit into the bigger picture. You can link associations. So you can see how different parts of this all link together, and you can see how the concepts flow together. And all of this helps you to understand the topic. And then when it comes to learning, it can, if you use it correctly, help you remember the content, help you to understand it, and help you to apply it. So these are kind of the first three levels of Bloom's taxonomy. So again, you can link this understanding back to understanding over here. So you can see how things link in the mind maps. Now, first thing I want to start with is a kind of warning. And this is a warning that I learned through personal experience and have since kind of really thought about how using mind maps in this way will really make you come up short in your exams. So this is how to not use mind maps. So this is how I recommend you avoid using mind maps. So firstly, I want to talk about, basically take a step back and look at how you'll know my external internal database sort of strategy if you've been through my videos before, but I want to talk about how you basically learn. So you've got resources such as lectures and textbooks and sort of clinical placements, videos, podcasts, all sorts of resources. And you take these resources and you put them into an external database. which is basically your set of notes. But it doesn't mean notes as in you've made those notes. It means notes as in you've collected together and organized and put those notes in one place. And the purpose of the external database is to transfer it to the internal database. And this is your brain. So you're taking resources, you're capturing the information you need to know from those resources into your external database, and then you're using your external database to feed information into your brain. So you're basically downloading stuff from the external database. You don't necessarily have, you will have watched, hopefully, some of my other videos about creating the external database. But for example, if you have a 0 to finals textbook and you're learning medicine, this is your external database. You can just start with a ready-made external database. You don't have to create it. But, so within this analogy, where do mind maps fit in? Well, here's where I would suggest you don't use mind maps. Don't use them for this bit here. Don't use mind maps to capture information into your external database. Because what you're doing there is you're saying, okay, I take the textbook, create a mind map, that's my external database, and then use the mind map to learn from. I wouldn't recommend doing it that way, and I'll explain why in a second. This is the high value activity. So the high value activity is taking your external database, for example, this textbook, the 0 to finals book, or if you're studying some other topic, it could be your course book that's designed to be studied from, and you're transferring that to your internal database. This is where you should use mind maps. And I'll explain the full process as we go through this video. So just to really summarize that, say you've got textbooks, and you've got lectures, and you've got other resources. So like online videos, podcasts, small group discussions, teaching sessions, clinical placements on the ward, that kind of stuff. And then you're taking this and you're capturing information into a mind map, and then using that mind map to put stuff into your brain. This process here of capturing stuff from the textbooks, lectures, resources, and so on into a mind map to use later into your brain takes minimal processing. And this is what I don't want you to do. Don't do this. Okay, so basically what do I mean here? Well, this is where you sit down with a textbook and you have your piece of paper next to it, and you're essentially, as you read through this textbook, you're drawing out a mind map. And so you're using the mind map as like your traditional kind of notes, where people sit there and they copy out a textbook into their notes. What I'm saying is you could be sitting there copying the textbook or the lecture slides or whatever resource you have straight onto a mind map. This takes minimal processing. All you're doing is copying from one place to another. You're not processing that information in your brain. And the lack of processing and the lack of effort and strain and applying the information in a novel way, that is a very low value activity. Then when you're trying to later on transfer that mind map to your brain, you're limited. Why are you limited? Well, because this here, let me just draw this so it makes a bit more sense. This bit here where you're taking your mind map that you've just copied out from a textbook and trying to put it in your brain, this mind map has captured your limited understanding. It lacks context, and it will limit your learning. So this is what you shouldn't do. So sit there with a textbook, copy that textbook onto a mind map, and then later try and learn the mind map. The problem here is that, firstly, you're doing minimal processing when you're creating the mind map. So you're not getting the benefit of mind mapping. You're just basically copying a textbook onto a piece of paper in a new format, which is not that helpful. Then when you're trying to learn that mind map, it lacks the context of the original textbook. You're just learning from very basic information. That mind map has captured you as from 6 months ago when you were first doing the topic and you didn't understand it. You've captured that information in a really basic way that doesn't make sense, lacks context, lacks understanding. And then you're trying to learn from basically you when you first read that topic. And you, when you first read that topic, didn't know very much. So this is a bad strategy. I have done this strategy. So when I was in my third semester of medical school, I decided I wanted to do the best I possibly could in that third semester. I thought now's really my time to knuckle down and try and achieve my optimal results throughout the whole of medical school. I really want to nail this semester. And I'd read a book over the summer by Tony Buzan all about mind maps and how powerful mind maps were. And I thought, yes, this is my answer. I'm going to do really well. So day one, I started mind mapping the whole semester. I took every lecture, every clinical contact, every textbook, everything I could get my hands on. I tried to cover the entire curriculum, copying the textbook or the lecture slides or whatever it was onto a mind map. I came away with hundreds of mind maps, and I actually went to the effort of memorizing every detail on all of these mind maps, so I could almost reproduce the mind maps from memory. And so I'd done this exact strategy. I'd taken the resources, I'd converted them to a mind map, and then I'd transferred them into my brain. And what happened in that semester? Well, I scored the lowest score I've scored in any semester, in any of the semester tests in medical school. So even some semesters where I crammed in 2 weeks before the exam, having dust around the whole semester, I scored better than I did with this mind map technique. What was the problem? Well, the problem was I was just very mindlessly copying stuff onto the mind maps. I was working in the library 10, 12 hours a day because it was so low intensity and didn't require much processing. And then I was memorizing these mind maps without really understanding the content because I'd just done this really passive approach of transferring to mind maps. So this has not worked for me. Theoretically, I don't think it's going to be a very good strategy for anyone. Avoid doing this kind of mindless transferring to a mind map, then transferring to your brain. So, having given you that warning story about what not to do, let's talk about effective use. So this is how I would recommend you use mind maps because they can be very powerful. So the way to use it is when you're going from your external database. So this is written content like you'd have in the Zero to Finals textbook, and you're transferring that to your internal database. And at this point, mind maps help. They can help you with this process of transferring stuff from the external database, from the Zero to Finals book or your collected set of notes, to your internal database. So how do they help? Well, they can help you practice recall. And remember, when you want to write something to your long-term memory, the way to do that is to recall it, not to absorb it, but to recall it. And so they can help you practice that recall. They can help with your understanding. And we've been through, how it can help you see the bigger picture, then the details, fit all of those together. And it can help you visualize the topic. So you can see a kind of how everything fits together, visualize it, how all the parts are connected. But this is it's used as a way of transferring stuff to your memory. So it's taking stuff off the page and putting it in your memory, not taking stuff off the page and putting it on another page. I'll explain. So what is this process? How do you use the mind maps? Well, I'll go through all the steps in this process, and then I'll give you a demo of me implementing this exact process as we study through a topic together. So first of all, before you even look at that topic, so we're going to do C. difficile infections and study through that topic. But before you even look at it, you sit down and you draw the mind map on that topic from memory. So you sit down and draw it without having studied the topic at all. And now, if this is your first review, you're going to have little on your mind map. So you might have, say we're doing Clostridium difficile, and it's the first time you've ever done it. You kind of know it's an infection in the bowel, but that's about all you know. So that's all you're going to draw for your mind map. But when this is the kind of second, third, or fourth time you've been through this, the second, third, or fourth repetition of this topic, at that point, it's going to be more detailed because you will have done this process before, and so you might have a kind of lots more ideas in your head that you can link together. Remember, these are spaced repetitions. So you do it the first time, and then the second repetition of going through that topic will involve exactly the same process, but this will be, say, 10 days from now. Then what's the next step? Is you read and recall. You might see my video on read and recall, or you're kind of listening to the topic, you're watching the topic, you're in a lecture, you're in a small group teaching session, you're on the ward, you're seeing a patient with this condition. You're somehow consuming that content, trying to understand it. Then importantly, there's a period where you're thinking and processing. So you kind of read through it, you've done this read and recall technique, which we'll go through in the demo. Then you're kind of thinking and processing, and you're kind of imagining how everything fits together. You're thinking about how it might apply to whatever kind of scenarios that you're going to be using this information in. So you're really kind of just thinking about the topic and how you can apply that information, how it all fits together, and also thinking, now that I've just read through it, what questions do I have? What gaps do I have in my knowledge? What stuff can't I remember from what I just read? Then, while you're thinking and processing, you might want to flick back through the content you've just read. Then the next step is that you draw a mind map of that topic from memory. So this is important. It has to be freely recalled from memory. You're not copying this from the textbook. The textbook is now closed, or the resource is now closed. And while you're drawing this mind map from memory, you're trying to map out the concept. So you're taking the bigger picture, and then you're trying to map out the branches of the mind map, looking increasingly more detail at that topic. it may be helpful to imagine explaining it to someone. So imagine how you're going to explain this concept while you're doing the mind map, while you're visualizing it, and while you're sort of creating a visual representation of that topic. Think about how you would be explaining that to somebody. And then when you are finished with the mind map, or you think you've finished, you've reached the limit of what you can do from memory with the book closed, you can go back and check some details. So when we do the demo, you'll see this, but let's say you kind of get to a certain point and you're talking about the management of a condition and you think, there's that name of that drug that needs to be used in this condition. I'm trying really, really hard to recall what that name was, but I can't remember it. And then at the end, once you've done everything in the mind map, then you go back to the textbook and you look up the details that you're missing. Then if you want to go to super advanced levels, if you have the time, at this point, you've finished your mind map, you've rechecked the details, you've added a few things in. Now you get rid of that mind map, you put it over to one side where you can't see it, you close your textbook again, and you try to redraw it from memory again. But this time, this is your second attempt at drawing this mind map from memory. You'll find that you may be able to reorganize the content better. So the second mind map that you do from memory, likely you're going to remember more stuff. And by remembering the stuff, you're writing it to your long-term memory. And you'll be able to organize that content better and actually produce a better mind map that makes more sense. So you're doing exactly the same process. It's the same process, but the second time round. So you're going to be doing it much better. And by the more times you recall the information, the better it's going to stay in your memory and the better your understanding is going to be. And the more you're going to pick out issues that the more you'll be able to pick out gaps in your understanding. So as you're going through it, you'll say, actually, I've realized that I don't understand this as well as I thought I did. And I'm going to need to go back and do it again. So again, you can check the details if you need to on this one. So now you've done it twice. I mean, you could keep doing this as many times as you like, but you're going to run out of time. And also you don't want to spend way too long on a topic on one repetition. You're going to come back to this topic again in 2 weeks and do the same process. So you don't need to be 100%. And then the final step in this process is throw away the drawings. Now, this is going to be a bit controversial. I'm sure people will disagree with me on this and say, oh, you can use these to recheck the next day and revisualize it the next time you come back to the topic. But I think this is important, that you throw away all the scribbles you've done. There's a few reasons I think it's important. You're creating these mind maps to learn. You're not creating it as a future reference. This is not a set of notes you're creating. This is creating in order to learn. So you're actually learning from the creating process, not creating something for the future. And I really want to stress this is important because if you create with the mindset of I'm creating something to learn from in the future, what you're doing is delegating the retention of information to the paper, not to your brain. You want to focus on, this is storing stuff in my brain, not storing stuff on the paper. You're only using the paper as a way to help you store stuff in your brain. So this is not a storage system. If you decide the paper is a storage system, your brain will switch off and say, don't worry, it's stored on the paper. I don't need it in my brain. So if you keep it, what happens is you're limiting future learning. So if you decide to keep this mind map, what happens is you then decide, okay, I'm going to learn from this mind map in the future, but that mind map is not perfect. There's gaps on the mind map. It could be better. And so if you're learning from this imperfect resource in the future, you're kind of limiting the extent to which you can learn. Whereas if you go back to the original material, there's no limit. Also, it slows the process. So if you're trying to create a nice resource for you to learn from in the future, it's going to slow you down and you're going to take longer to map things out because you're going to want to draw it nicer. Your handwriting is going to want to be neater. But if you're just scribbling it down as a process to help you learn, it doesn't have to be perfect. So you can go much faster. It also increases the pressure. So you want this process to be quite fast, really. You want to just get through it and, not spend all day creating these mind maps. And you want to be able to just go for it and try, not feel too much perfectionism and pressure. And if you're deciding you're going to keep these to learn from later, you put too much pressure on yourself to make something nice, and that will just become a barrier. And if you are deciding to keep it, what will happen is this encourages copying rather than recall. You really want to focus on recall, not copying. And if you're going to create something that you're aiming to keep, you'll start being tempted to copy the information directly from the book rather than copying it from your memory in the form of recall. So this is why I don't want you to keep the mind maps. Just use them as a learning process, not as a storage system. So now we've gone through that whole strategy, I'm going to give you a demo now to explain how I apply this to learning a new topic. For this example, I'm using the Zero to Finals medicine book, which is designed to be an external database, not a traditional textbook where you have to kind of simplify what's in there. It's already simplified, but with all the necessary details. So it's really easy to learn from. And this is perfect for learning medicine if anybody's learning medicine. Today, we're going to go through a topic which is Clostridium difficile. And we're going to go through that topic together and use this strategy I just talked about. So you're going to need a pad of paper that you can write on to do your read and recall and to draw your mind maps. So before we even open the book, we're going to do a mind map on Clostridium difficile. So we're going to do start with our mind map, and we can make it colorful. So what I'm doing here is recalling everything I can remember about C. diff, having not studied it yet. So remember, if this is your first review, it will be a bit limited, but if this is your second or third or fourth, you'll remember much more. So C. diff, let's see. So what are going to be the topics? So maybe the pathophysiology, then it'll be maybe the presentation of C. diff, and then what can be down here? Investigations. So how do you diagnose it? Then we could look at management, and then maybe complications. So I've kind of done an overview of these are going to be the big topics that we're going to cover. So pathophysiology, it's a bacteria. It lives in the bowel. And I remember something about, let's add another one, risk factors. And I know it's increased risk with antibiotics. And then the presentation is abdo pain and loose stools. And it's an infection, so probably it can give you a fever. Now, what investigations? I can't remember. So I think it was a stool sample to diagnose it. I think there's something about the toxin. So the toxin, you might be able to diagnose on a stool sample. Now, management-wise, I know it's more antibiotics, but what antibiotics would you give? And the complications, I know there's some complication where the bowel becomes very upset, but again, I can't remember these complications. Okay, can I remember anything else about C. diff? So I've drawn out my mind map here, and this is kind of a representation of my current understanding of C. diff. You know, you start with the big branches: pathophysiology, risk factors, presentation, investigations, management, complications. And you try and link things together. And then as the branches go out, you get more and more detail. But I'm a bit limited here. So now what we do, you get rid of this. And at this point, we start doing our read and recall technique. So what does the read and recall technique look like? Well, it's very similar to what I just did. So what we do is C. diff, bring it down. C. diff is a gram-positive rod-shaped anaerobic bacteria. Okay, gram-positive. So I remembered that it was a bacteria, but I didn't remember any details with that pathophysiology. So I got to remember, okay, gram-positive is rod-shaped and it's anaerobic. You'll notice I'm not creating a mind map at this point. This is me scribbling down stuff. I'm trying to recall it, and I'm scribbling down stuff because it's helpful to actually write physically with your hand the stuff. Again, I'm going to get rid of this piece of paper at the end. So you bring the piece of paper down a bit further. C. diff is associated with repeat antibiotics, proton pump inhibitors, and healthcare settings. Okay, so when I had my branch in my mind map, which was risk factors, I got the antibiotics one, but I didn't remember the other two. So from memory, those other two were healthcare settings, antibiotics, and proton pump inhibitors. So PPIs and healthcare. So again, I'm just scribbling those down to help me remember that for future. Then I bring the page down. C. difficile produces spores released in the feces. Spores can survive on contaminated surfaces and hands, helping to spread to others. Okay, so importantly, it creates spores, and these spores are on surfaces. And this is how that transfers to others. Okay, remember spores? It may colonize the intestines without producing any symptoms or issues. When antibiotics interrupt the normal intestinal microbiome, C. difficile can proliferate. So that's how antibiotics, they upset the intestinal microbiome. So they kill some of the other bacteria, the kind of friendly, happy bacteria, and that results in C. difficile thriving. Okay, C. difficile can proliferate. It produces toxins, which cause symptoms and complications, particularly toxin A, which is enterotoxin. So where do we have? So it produces toxins. I remembered on my mind map that it did produce toxins, but I didn't remember that there were two, toxin A and toxin B. And toxin A was enterotoxin. Yep. And toxin B was cytotoxin. Entero and cytotoxin. Okay. Now we go to the next bit, which is antibiotics. So which antibiotics increase the risk? I can't remember. Hopefully this tells us. The antibiotics most associated with C. diff start with the letter C. Okay, so C, we got clindamycin, ciprofloxacin, cephalosporins, and carbapenems. Okay, I'm going to try and recall this in a second. So antibiotics, I make a little note for myself that there's 4 antibiotic groups that I need to remember. But let's carry on. What's the presentation? Okay, we came up with a presentation before. Colonization is usually asymptomatic. Okay, that's worth remembering. Colonization, so you can have C. diff without any symptoms. Infection presents with diarrhea, nausea, abdominal pain. Okay, pretty much got that. Severe infection with colitis, colon inflammation. So if there's colon inflammation with colitis, dehydration and systemic symptoms like fever, tachycardia, and hypotension. So the blood pressure can go down. So it's like kind of sepsis, really. Okay, on to the next one. Diagnosis. How's it diagnosed? Stool samples. I did add that to my mind map. But the stool samples can be tested for. Okay, what could the stool samples be tested for? I'm guessing the toxin and the bacteria. Let's have a look. C. difficile antigens, specifically glutamate dehydrogenase. Glutamate dehydrogenase. So this is the antigen. So this is part of the C. difficile bacteria, one of the antigens. You can test directly for that. I'm going to guess the other one is the toxins by PCR or enzyme immunoassay. PCR or enzyme immunoassay. Okay. The antigen test shows whether C. difficile is present, but not whether it's producing toxins. Yep. The antigen is the initial screening test, followed up by toxins. Okay. So what's the management? In fact, before we do that, let's go back and do from memory this little test I'd given to myself earlier. So these were antibiotics. They all began with C. So let's do, I'm going to imagine coamoxiclav, ciprofloxacin, cephalosporins. What was the other one beginning with C? So I can't remember the final one beginning with C. Let's have a look. Carbapenems. Oh, it was clindamycin, not coamoxiclav. Okay, clindamycin and carbapenems, like meropenem. Okay, so by coming back to that earlier topic, by coming back to that earlier thing, that little assessment I set myself, helps me recall that information. And then when I fill in the gaps in my knowledge, that really helps me to learn. Okay, on to the next thing. Management. Okay, we've got this piece of paper, it's full now, but we don't need this anymore. This is not notes for the future, so I'm just going to get rid of that. Got a fresh pad of paper. So management, I couldn't remember the management on the last one. Management is supportive and oral antibiotics. So what were the oral antibiotics? Oral vancomycin is the first line. Okay, vancomycin. Oral is the first line treatment. And oral fidaxomicin is second line. Fidaxomicin. Okay, cover that up. Fidaxomicin. Is it Y? Oh, it's mycin. Okay, fidaxomicin. Fidaxomicin. Again, orally is the second line. Patients need to be isolated until 48 hours after the last episode of diarrhea. So isolation, 48 hours after the last episode of diarrhea. Could be a long time. There's a high recurrence rate. Fecal microbiota transplantation is an option. Okay, so fecal transplant. The stool microbiome from a healthy donor is transferred to the patient by capsules, colonoscopy, or enema. Okay, fecal So I'm going to try and remember that from memory. Microbiota transplantation. And the options for this are capsule, endoscopy, was it? Or enema? Let's have a look. Yeah, colonoscopy, enema, capsules. And finally, we're on to complications. So I couldn't remember when I did that first mind map what the complications were. Pseudomembranous colitis. Okay. Pseudomembranous colitis. Okay. It's characterized by inflammation of the large intestine. Colitis, large intestine, with yellow-white plaques that form pseudomembranes on the inner surface of the bowel wall. So these plaques are like pseudomembranes, so like membranes on the inside of the large bowel. Seen during a colonoscopy and confirmed with biopsies to examine the histology. Okay. And then the last one is, or the next one is toxic megacolon. So we've got pseudomembranous colitis and toxic megacolon. Complication of severe inflammation of the large bowel that involves dilation of the colon. Patients with toxic megacolon are very unwell, high risk of bowel rupture. Okay, it's an important complication. Treatment involves supportive care and surgical resection of the affected bowel. So they need surgery to remove it. And then additional complications are bowel perforation and sepsis. So we've got bowel perforation and sepsis. Okay, so now we've been through this whole topic on C. diff. We can close the book. We can get rid of this. And now I'm going to sit and process that. So we've got C. diff. It's a bowel infection, gram-positive, gram-negative, rod-shaped anaerobic bacteria. You do a stool test. So a patient might present with diarrhea. They might have had recent antibiotics. To present with diarrhea, you do a stool test, shows the toxin and the bacteria, the antigen. And then you give them oral vancomycin. And you obviously worry about the complications, which are pseudomembranous colitis and toxic megacolon. So now let's use mind maps. Let's create a mind map on C. diff. So we're going to create a mind map here and use this as a way of learning to really consolidate what we just read. And if you want to make this even more powerful, you could go and get like a cup of tea, a cup of coffee, have a 5-minute break between the reading to allow your brain time to process, and then giving it a break before you come back and recall everything really helps to get that information to stick more than recalling it immediately. So imagine I've been for a 5-minute break, come back, been to the toilet, got a cup of tea, whatever it is. Now I'm coming back to recall everything from memory. So you've got C. diff. So let's start with the bacteria. Then we'll do some pathophysiology. Then we'll do presentation. Then we'll do testing or diagnosis. Then we'll do management. And we'll do complications. So we're doing all of this now from memory, trying to recall what we just read. So the bacteria was gram-negative. I think I might have got this wrong. I'm not sure about the gram-negative or gram-positive, but I need to look this up. It's rod-shaped, and it's anaerobic. So basically, pathophysiology is... one thing I've forgotten now is risk factors. So let's do the risk factors where healthcare settings antibiotics, and PPIs. And we can go one step further with the antibiotics because it was the C's. So clindamycin, ciprofloxacin, cephalosporins, and carbapenems. Okay. Now, the pathophysiology. So it would be like the antibiotics will interrupt the gut microbiome. And it produces toxins, and toxin A and B. And A was enterotoxin. And B was, I can't remember the name of this toxin. So I need to fill that in later when I come back to the book. Now, the presentation, it was, presents with, so asymptomatic if the patient is just a carrier. So if the patient has a colonization, and then usual symptoms are diarrhea, abdo pain, and nausea. And then if it's severe, they have basically signs of sepsis, so temperature, tachycardia, and hypotension. Okay, testing. How do we test for it? So there's two tests. One is for the antigen, and this was, I think it was something like glutamate dehydrogenase. So glutamate dehydrogenase, I'll have to come back to that. And the other one was the toxins, and you could do PCR to look for the toxins. And I think the screening test, this was screening. So the screening test was to look for the antigen, and then you follow up with the toxin test. Management, oral antibiotics, and the first one was vancomycin, and the other one was fidaxomicin with an I. And the other option was fecal microbiota transplantation. And this could be capsules, colonoscopy, or enemas. So take a healthy person's feces and give that to the patient. And finally, the complications. So there was two complications. One was pseudomembranous colitis. This involved pseudomembranes. So these pseudomembranes were on the inside, and it was on the large bowel. And then the other complication was toxic megacolon. And they actually needed surgery. So now we have this mind map. This mind map is finished. And it's kind of highlighted everything that I could remember. I tried to put it all in a visual format on this mind map. So now I got this mind map, and I'm going to go back to the topic if I can find it. So back to the topic here, and I'm going to compare kind of what I have with my mind map to what's on here. So it was gram positive. I was wrong with this. I need to remember it's gram positive. And one way I can remember that is that vancomycin is much more effective against gram positive bacteria. So I can remember it's gram positive. So let's have a quick flick through. I think I got all of this stuff. The toxin B was cytotoxin. Okay. Then the antibiotics, I got them, clindamycin, colonization, infection, antigens, I got those. Antigen test is the first one, got those antibiotics. Okay, I need to remember, in management, a patient needs to be isolated. for 48 hours. This is a thing that I forgot. And it got the transplantation, pseudomembranous colitis, toxic megacolon, additional complications, perforation and sepsis. And sepsis. So that's that done. Next, I take this and get rid of it. I'm all finished with my mind mapping study session. At this point, I would recommend going to do some practice multiple choice questions and applying that information that you just learned to some questions on C. difficile. And yeah, so I've got rid of my notes. I'm finished with that. I'm quite happy. If you had a lot of errors, what you can do is close the book again, get rid of the mind map, and then do that same process. Go and have a cup of tea, have a toilet break, take a short break of 5-10 minutes, and then come back and redo the mind map again one more time to really get that stuff to stick in your memory. And then you're done. Close the book, record your confidence in your tracking table, and then come back to that topic in, say, 2 weeks, a month, however long your spaced repetition is, and do the same process. And what you'll find is, if you are doing the mind map before studying, if the mind map you do before studying is really accurate and has loads of, contains almost all the information, your study session will then be really quick, because all you'll be doing is saying, yeah, I remember this. Yeah, I remember this. Yeah, I remember this. And so you won't have to go into all the details. You can just fill in any small gaps in your knowledge. So I hope that video on mind maps was helpful. Don't do what I did in my third semester and just mindlessly copy stuff onto a piece of paper. Use it as a learning tool to get stuff to stick in your memory. If you want a really nice version of these notes, or the notes that I created alongside talking in the first half, so that you can see basically the structure of how you use mind maps and refer back to that really quickly, you can download them on the Zero to Finals Patreon. There's a link in the description below. And I'll see you in the next video, which will be tomorrow.